name's Bennett. This is my capstone project for Honors Mentorship at Forsyth. Go to the essential question part. So we had to research one question throughout the whole year. We picked something we found interesting and sort of researched about it. So I picked, why do infants and young children develop food allergies? So I was really interested to see how this happens, risk factors and stuff like that. So that's my project. A little bit about me. Again, my name is Bennett. I'm a senior at Forsyth Central High School. I'm also dual enrolled at UNG incoming, so I take classes there. I like biology and anatomy classes. I also like watching sports and playing sports. I'm part of the Honors Mentorship program at Forsyth, and I shadow at the Children's Healthcare of Atlanta in Forsyth. I get to see, what they do there. I like doing this because I want to become a nurse practitioner, and that's helped see what sort of healthcare physicians and other doctors and stuff like that, and the therapists get to do with kids. So I really enjoyed working there. I'm mentoring at the Children's Healthcare of Atlanta and Forsyth. I've been through 3 departments right now. I'm in rehab with Cheryl. I've been in orthotics and prosthetics with Mark. And at the beginning of the year, I was in the sports medicine part of it with Chris and Keith and Ashton and all them. So I've been around different departments. My plans for next year to go to UNG in Dahlonega and major in nursing. I want to get into nursing school as soon as possible and start working in a hospital and helping people, because that's what I'm passionate about. This mentorship will really help me get a good head start of what that's like, get some hours in and stuff like that. So it's been a great opportunity. And then that's just a picture of me with my mentor. So the research part of this project, online sources are actually a good resource for this, so I use those a lot. But this was at the beginning of the year. I answered some questions. First, it was what I need to know, and that's my essential question, which is, why do infants and young children develop food allergies? So last year, Kendall was diagnosed, and she found out that she was allergic to dairy, and so I realized how much that changed her life. You think, oh, you just avoid milk and avoid things that have milk, yogurts and ice creams and stuff, but there's so many things that have dairy in them that you don't realize. Like every little thing, you have to check every label that she has and stuff. It changes the way you eat and where you go and stuff like that. And I just realized how much of a big change that causes. And so it got me thinking about, how does this happen? How did it develop? Is there things that you can do to try and prevent this? So that's sort of the reason why I chose this topic. What I knew from the beginning of the year was that food allergy is an immune system response to a certain food that causes the body to treat it like a harmful substance and attack it. So your body sees something that's usually normal, and it recognizes it as like an outside foreign thing, and it causes your immune system to basically attack itself. Food allergies typically develop when you're young, and children and young kids oftentimes outgrow an allergy if you treat it right and you avoid it. And research has shown that there are some factors that help prevent food allergies, such as breastfeeding as a child and introducing allergens at a young age, which I'll talk about more. Some of the search for my research, I use, like I said, internet sources, and I also did an interview with my mom, since she's a physical therapist, so that taught me a little bit more about it. An outline of what I discovered were some of the risk factors associated with it. These were overuse of antibiotics, family history of allergies, exposure to tobacco smoke, avoiding breastfeeding, and not exposing children's immune systems to certain common allergens. So these are some of the things that can significantly increase your risk of your child developing a food allergy. Some of the ways that you can help combat this are breastfeeding as a child, exposing them to small amounts of common allergens between 4 and 6 months old, limiting your exposure to excessive antibiotics, and managing related medical problems such as eczema and asthma. Eczema and asthma are also actually immune system allergens, so by regulating those, you keep your immune system in check and lower the increase of them getting a food allergen. And then I went to the annotated bibliographies, and I researched 3 good clinical studies and research trials, and then broke them down into the major parts and described them. So the first study was talking about the antibiotics, and they found that the more antibiotic prescriptions a child is on, the more likely they're actually to develop a food allergy. So children receiving 3 antibiotics had a 31% higher chance, 4 had a 43% higher chance, and 5 or more antibiotics was a 64% increase in developing a food allergy. And sort of the science behind this was the more antibiotics you take, the more there's certain bacteria and enzymes in your gut, and the antibiotics break those down and make your immune system more susceptible to overreacting to certain foods, which I thought was pretty interesting. I had no idea that there was a link between the two. The second study, they just researched a bunch of the risk factors and stuff like that for developing food allergies and found some information. They pointed out that the prevalence of food allergy in childhood increased in the last decade, especially in westernized countries. So the more modernized we get, we have cleaner healthcare and cleaner facilities, and that's good, but it lessens our exposure or our immune system to the germs and stuff around us. So while we're healthier, it also means our immune systems are weaker because we're not exposed to as many things as we would be in the past, and that sort of like puts a bubble around our immune system, so we have a tendency to overreact to things like common food allergies since we're not used to being exposed to those things. One of the most common and effective ways to combat a food allergy is to introduce it to infants. They noted that earlier or not delayed introduction of the food into infant diet has been highlighted with significant results. So this is one of the most effective methods that researchers have found. Another common method is breastfeeding. Exclusive breastfeeding for more than 4 months was associated with a reduced risk of cow's milk protein sensitization during early childhood up to the age of 2 years. That's an easy way to help reduce the risk of a child developing a cow's milk allergy, which is one of the most common ones. And then finally, one of the most recent methods is immunotherapy. Food allergy-specific immunotherapy has appeared as an optional treatment, although still confined to an experimental clinical setting, showing high evidence of efficacy, but with lack of studies on safety and long-term follow-up. This is a new thing for children with allergies. They're trying to introduce immunotherapy, which is sort of, it's like exposing your immune system gradually to common allergens so your body can get used to it slowly over time. And this is a promising new research method, but it's super new. So hopefully in coming years we'll be able to actually treat food allergies and cure them over time, but that's new research. So the last study I did, it was also analyzing some of the risk factors and ways to combat food allergies. They said that the key to preventing food allergies appears to be exposing a baby's immune system to potential allergens before they have a chance to develop allergies, which is a narrow window of opportunity. This is, again, one of the most effective ways to combat it. Some guidelines in the US and Australia now recommend slowly and carefully introducing infants to potentially allergenic ingredients from the age of 4 to 6 months. That's the key. 4 to 6 months is a really narrow time frame, but that's the time when you should really focus on getting your kids exposed to these foods, because they're too young typically to develop any sort of allergy before that. They're not going to have a reaction, but that's the time period when their immune system is really developing, and by exposing it to them, their body gets used to it and they're much less likely to have adverse reactions in the future to those foods. So that's a good key right there, is 4 to 6 months. A study outlined in this article found that those that are introduced to peanuts between the ages of 4 and 11 months are 81% less likely to develop a peanut allergy by the time that they're 5. And children who began eating eggs at the age of 4 to 6 months are less likely to develop egg allergies. So you can see some of those numbers, how much of a difference it makes exposing the kids at a young age while their immune system is developing. And so that just shows how important it is. My research has taught me a lot about this project, and I felt that it would be good to share it with new parents, new grandparents and stuff like that, because this is something I didn't know a lot about. I thought, 10 years ago physicians would actually recommend just staying away from allergens because you don't want to cause an allergic reaction. But now it's the opposite, and you want to expose them to it. And so I think these are things that everyone can benefit from, especially new parents, and it's something we should all take and apply in our lives to help make people safer and more aware. And so thank you.